Welcome, everyone. Thank you for taking the time to join us for today's webinar, part of our webinar series, Building Better Research, RCT, Design and Implementation. Before we begin, please note that this webinar is being recorded and that I'll make a version of this webinar available on our website in the upcoming weeks and also share a recording of this webinar via email. So by participating in the session, you are consenting to being recorded. I'm Raquel and I work as a Senior Policy Associate for JPAL Africa. I'm joined today by Professor Andrew Dillon, a JPAL affiliated professor, associate professor at the Kellogg School of Management, and a research professor at the Global Poverty Research Lab at Northwestern University. Professor Dillon will be sharing his insights on measurement and randomization in randomized evaluations, drawing from his extensive field experience. Please feel free to add any questions to the chat as we go along. And we will have a Q&A session in the middle and then again towards the end of today's webinar. I would now like to hand over to Andrew.
Great. Thanks so much, Raquel. And thanks to Raquel. I think Lauren has been working on putting these series together and all the JPAL Africa team. I'm excited to talk to you today about building better research. And I'll stop to take some questions at various times during the presentation. So if you want to record, as Raquel was saying, your questions in chat, then we can kind of triage those questions at that time. But I hope we'll have a conversation, especially at the end, where I'll leave some time to talk about kind of doing better research and talk through some of the things that you're thinking about, some of the challenges you're facing in designing randomized control trials and other types of empirical work. So I just kind of wanted to start off this talk, which is going to focus on kind of measurement, specifically like in agricultural studies, but also, generally in how we think about designing good research. With this quote from Gerlichis, which is from the Handbook of Econometrics. So he says, at one level, the data are the world that we want to explain, the basic facts that economists purport to elucidate. At the other level, they're the source of all our problems or all our troubles, right? So, you know this because you're concerned and have been thinking about randomized control trials with JPAL. We're concerned about selection bias, the way that data is generated. But as economists have done more randomized control trials and done more field research, we're also concerned about bias in our studies related to measurement error, the way we measure different concepts, but also in kind of testing models in the absence of the right variables, right? So at the heart of an empirical economist's challenge is to address how the data is structured, how the data is generated. And that comes to us in the form of kind of selection bias, but also measurement challenges to create good evidence that hopefully makes an impact and helps people in the world through the research. So, as you know, as part of, the JPAL network, economists have been investing in research infrastructure to create the data that they've wanted. This has come not only through the efforts of JPAL and other organizations like IPA, the World Bank, the LSMS, the former DHS surveys. So there's been a huge investment, huge international investment since about the 90s in constructing the data that we would like to have to answer important questions. But it also has raised lots of interesting research questions around how do we make empirical choices in designing the data we want from the perspective of theory or measurement or either sampling and coverage. And that's what these kind of seminars are really about, is to kind of talk through some of these issues to build better research and think about how to generate better evidence. So here's going to be my answer. Here's the short version of what my answer is going to be today, or a few answers, I think, in ways that we can build better research to address some of these challenges in the time they have. This is obviously not all the land or the roadmap to kind of building better research, but here's some things that I think are important to building better research and that I've had some experience with, and I'll share some examples from my research. So how do we build better research? One is, I think, addressing measurement challenges and expanding the research frontier by integrating methodological experiments into pilots and main studies. So we have lots of questions about what the right way to measure things is, how to measure difficult concepts that respondents that are economic concepts that respondents as non-economists may not think about in the same way that we do. So asking them questions can be challenging in getting to reveal the economic concepts that we actually care about. So one way to address this challenge is by integrating some methodological experiments into our studies, and I'll give you some examples of ways that I've done that in the past. The second thing that we'll talk a little bit about from a study that I did in Nigeria is to think not necessarily about doing an RCT or having as an objective to do an RCT, but as an empirical economist to think about how do you create the counterfactual? How are you going to identify the relationship that you'd like to estimate in your data by creating the counterfactual? And a lot of times we can create counterfactuals by doing RCTs. But when we think about how to create the counterfactual, it also opens us up to a wide range of ways to create exogenous variation in our data that's not just simply treatment and control or A/B testing. And so by thinking about creative ways to create counterfactuals, we open up a new set of research questions that can use the tools of randomized control trials in new and interesting ways. Okay. And then the third way that I'll talk about today about kind of building better research is to think a little bit about mode integration. And what I mean by modes is, the way we collect our data. So in a lot of cases, we think about collecting data with face-to-face household surveys. That's been kind of the workhorse of development economics. But technology's opened up a wide range of ways to generate data, either by using passive sensors. I'll talk to you in a little bit about a study that we did where we fitted sugarcane cutters in Nigeria with a physical activity monitor, a passive sensor, to track their physical activity. So that's one way that technology allowed us to understand physical activity and productivity of workers in a new way by measuring their physical activity as opposed to just self-reported output that workers might report. But there's lots of different kind of survey modes, thinking about audio recordings, remote sensing data, crowdsourced data, or telephone surveys. These modes allow us to collect different types of data than we might be able to get from face-to-face surveys, but they also change and lower the cost of the frequency at which we can collect data. So household surveys can be expensive to field. And so they might not be the best tool for us to gain high frequency data. So if we're interested in more market-based or more high frequency data, some of these technological integrations with household surveys are kind of interesting ways to think about building out the research frontier. So that's just kind of a preview of the things that I'll talk about. And let me give you some examples of the ways that I've tried to do this in my work. And some of the challenges and things we've learned by going through that, by doing those things. Okay. So first to get to this kind of measurement challenges, when you design a household questionnaire, a lot of times you face challenges in survey design choices. There's lots of great resources, both from JPAL, also the LSMS group with their guidebooks have great resources on questionnaire design. And we're beginning to aggregate more information about what the trade-offs are of different survey design choices. One survey design choice that people think quite a bit about, especially in agricultural surveys, is kind of which respondent to ask agricultural questions to. In many households in Africa, there's multiple farmers within a household. Some farmers may work together on communal plots. Other farmers may have individual plots. And so which respondent to ask about agricultural production can be a challenge. And we have some good research already on kind of differences between how self-respondents report when someone responds for themselves about their own production versus a proxy respondent when somebody's responding on behalf of someone else about their agricultural production. And in the household survey literature, there's kind of this implied preference for self-reporting, even though we might acknowledge that self-reports themselves may be biased. But we have kind of in our head a mental model that a person may know their own production better than someone else in the household may, because of this idea that there's asymmetric information in the household. There's not perfect information sharing about production activities within the household. But at the same time, if you've ever fielded a survey, getting each person in the household to respond who's a farmer, can be time-consuming or is potentially time-consuming. It's a more onerous kind of survey protocol or research protocol for field staff. So proxy response is really attractive to a lot of survey designers because it potentially lowers your data costs, it potentially requires fewer visits to the household, but there's this kind of trade-off in potentially increasing the measurement error in your survey data. And unfortunately, we don't have a lot of evidence about what these trade-offs are in terms of like the magnitude of measurement error bias from different ways of collecting these data and the costs when we use different respondents. So we actually designed with Edward Mensa, who's at Penn State, and I designed this methodological survey experiment to kind of estimate what respondent biases may be in household surveys. There are kind of like two mechanisms or sources of measurement error that we were particularly interested in identifying in this relationship between proxy and self-reporting. In a lot of the other literature on proxy response bias, they're just kind of comparing proxy responses to self-reporting. But as we thought about things a little bit more deeply, and we actually looked at the ways that household surveys were designed with proxy respondents and with self-reporting, we did identify kind of like two different pathways through which measurement error could creep into those kind of survey estimates. And one is this kind of classic interpretation of asymmetric information that proxies just may not know as much as self-respondents would. And so this is certainly one source of potential bias and kind of the dominant interpretation in thinking about differences between self-respondents and proxies. But the other is aggregation bias. So a lot of times when people design surveys with only one respondent or a proxy respondent that's responding for the whole household, there's also this aggregation bias. So the proxy respondent is oftentimes asked to report for the whole household in aggregate, as opposed to plot level data or individual level data. And so there can be this aggregation bias as well when we use a proxy respondent design that's not completely due to asymmetric information. It's just cognitively more challenging for a respondent to think about all the economic activities of all the people in their household and then respond in their place. So how do we kind of disentangle these two kind of mechanisms that might affect this survey design choice of using a proxy respondent? Well, we designed this randomized control trial, or what we call a methodological experiment, where the objective is to really measure the relative bias of different survey design choices using a randomized control trial. And so we basically have three different treatment groups where we administer the same agricultural module, the same questions to a household head respondent. In another treatment arm of the methodological experiment, we ask these production questions to a random proxy respondent. So we take all the potential farmers in the household and we randomize who the respondent is. And we identify that person as a proxy to respond on behalf of the whole household, as opposed to the household head. And then in the third treatment arm, we use a self-respondent to respond just for themselves on the same types of production questions. Okay. So what we're doing in this study is trying to identify these respondent biases due to asymmetric information and aggregation bias using these three treatment arms. So we have this self-reported production information, we have household head reported production information, and we have random household proxy reported production information. And what's interesting in the way we're going to disentangle asymmetric and aggregation bias using this experimental design is, in blue that I've highlighted, the self-reported information, the unit of analysis is at the individual or the plot level for this production information. And for the random household head, or for the household head and for the random proxy treatment arms, the unit of analysis, the object on which the respondent is reporting is going to be the household. The unit of analysis is the household. So when we estimate our treatment effects, when we compare the random proxy and the household head responses to the self-reported responses, the difference between those two are going to represent both asymmetric information and aggregation biases. But when we compare the household head to the random proxy, that's going to give us information about what the source of the asymmetric information is between the household head themselves and the random proxy. And so by isolating what is asymmetric information bias, we can infer the magnitude of the aggregation bias by differencing between the two sets of treatment effects that we can get by netting out the asymmetric information bias from the comparisons in the random proxy and household head to the self-reports. We can net those out to infer the magnitude of the aggregation bias when we choose a proxy respondent. And I'll just show you like kind of a high-level summary of the results. There's a lot of information on this slide, but in the first column, we basically show what the difference is between household heads, what the household heads report differently than the self-reports, assuming that the self-reports are kind of the reference. Note that I didn't say that the self-reports are the truth, they're just the reference. We're measuring relative bias here. But for example, in the first cell in this column for total area cultivated, household heads report 19% lower total area cultivated than self-reports. So that's an example of like the way to interpret these kind of summary treatment effects. In the second column, we look at the random proxies versus the self-reports, and then we can estimate the asymmetric information bias from proxy response and the aggregation bias. And so here for total area cultivated, we actually see that there's not a big difference in asymmetric information for land size, at least, within people in the household reporting. People in the household basically understand about how much land or reporting about how much land in a similar way, whether they're the respondent themselves or whether they're a proxy respondent. Where there's bias in land size measurement comes from aggregation bias. So when we ask people all the household land that's cultivated as opposed to by plot, then we see pretty large aggregation biases of about 18%, whether we use the random proxy or the household head. So this tells us something about survey design, how to collect total land size, for example. It actually doesn't matter whether you use the proxy or not. There's no real asymmetric information there. The important thing in collecting land size data is to ask by the plot or by the individual how to get that in terms of how to elicit those kind of land sizes. But you'll see as you go through some of these other variables that we collected on yield, for example, if you just look at cereal yield, the last row in this column, for example, you'll see that there's both asymmetric information, statistically significant differences in asymmetric information bias and in proxy response bias on things like yield, right? So we face some trade-offs depending on how you design your survey and which variables are potentially the most important. We face some trade-offs in which variables to collect and who should be answering those questions. And unfortunately, one of the results of this experiment is that we see for example, in the last column, that aggregation bias kind of uniformly lowers the agricultural statistics that we're estimating. For proxy response bias, or for asymmetric information bias, it's basically inflating the agricultural statistics that we're collecting kind of uniformly. So it gives us some guidance on how to design our surveys and what the biases potentially are in designing surveys, agricultural surveys at least, with different design choices, different respondents. Right? So just to give you an idea too about kind of some of the costs, so we want to think about like what the magnitudes of biases are relative to potentially the costs. Survey design costs change across different contexts, but what's useful in kind of comparing against context might be like the number of days or the number of hours that it takes to administer a different household survey design. And then we can calibrate the costs, the per day costs across different kind of contexts. And you can see if you look at the left figure that with random proxy, it's true that there's a slightly lower number of days that it takes to complete the whole questionnaire. But this is actually a relatively small difference in kind of number of days between the self-reporting, for example, in blue, and the green with the random proxy. The difference is about 0.2 days in the field, or about a quarter of a day, maybe. There's differences in time, certainly, between self-reported and data and asking a proxy respondent or asking the household head. The biggest difference that we were actually surprised about is the household head completed the agricultural questionnaire very quickly. The proxies actually weren't all that much more effective than the self-reporting, right? So in terms of time cost in the field, after you find the proxies or after you find the self-reported respondents, there's not a huge time cost or time savings between the random proxies and self-reporting, because the proxies themselves are trying to think about what's going on other people's plots in their household, and they themselves, that's cognitively taxing and time consuming for them to consider what their answers are, right? Whereas the household head is pretty quick about responding for himself or herself for those types of questions. So here's an example of how to build better research. Like we have these kind of fundamental questions about how to design an agricultural survey. And here's an example of a methodological experiment that could be designed either integrated in a pilot or even in a baseline survey, or even as a standalone experiment to kind of generate evidence about how to make this design choice, how to minimize bias in your data. So before I move to the next study, I'll kind of stop there. I don't want to talk too much, but maybe we can stop and do kind of 5 minutes of Q&A if you have some initial questions before I go to the next set of studies, which focuses on thinking about a counterfactual and integrating modes into the research. So I'll stop here, and if you have any questions, feel free to put them in the chat, or you can raise your hand and Raquel will recognize you.
Hello. Yeah, hi,
Or if folks are still getting warmed up, I can just keep going.
There was one question. Ahmed, you're welcome to ask your question.
Okay, yeah. So thanks, Andrew. Can you hear me?
Yes.
Yeah, I can hear you better now. Yeah.
Yeah, so thanks for the full presentation. So my question is with regards to the design when you are doing an RCT. If you don't do a baseline, for example, and you make use of an online survey where you kind of randomize and the participants get to see the treatment prior to answering the survey question. So like you have 3 treatment arms, you have an information type for treatment arm 1, and then treatment arm 2, they get to watch a video, and then treatment arm 3 is that they get to see both. And then, of course, we have a control group, and this is an RCT. So is it okay to say that you'd perhaps use randomization as a balance? I guess that's essentially my question. Thanks.
Yeah, so yeah, I think in general, without like knowing all the details of the study, I think one of the things that is useful, especially if we're showing people videos or having different types of activities that people can either pay attention to or not pay attention to, then we worry about selection bias, right? When we're thinking about comparing across the different groups in which we potentially showed some people different types of videos or passed different types of messages across the groups. And so randomization can be useful in allocating people to groups because on average, we would think that if the groups are big enough, and this is another important kind of assumption when we think about design, is to make sure that our groups are kind of sufficiently big, and we've done power calculations to assure that they're sufficiently big. But if we've done those things, then the take-up rates across the different types of treatments shouldn't bias our intent to treat effects across the different treatment groups. So that can be a useful strategy in addressing selection bias when you're not sure who might have more motivation to kind of take up these different treatments.
And so without having a baseline kind of survey, it perfectly works, right?
Well, it depends a little bit on how you've implemented things. I mean, baselines are good to potentially increase the statistical power by allowing you different kind of econometric ways of analyzing the difference with the data with either difference in differences or ANCOVA, and to validate that the randomization, at least on observables, was actually done. But in principle, if you have a randomization that was correctly done and you have enough statistical power, then you don't inherently need a baseline to be able to estimate treatment effects from the end line information. And in fact, a lot of ways that companies are doing A/B testing or things like that is using exactly that approach. So it can be a little bit more risky if, for example, some way the randomization wasn't implemented correctly. Or if you wanted to say something more about dynamics or changes, not having the baseline would prevent you from saying that. But certainly there wouldn't inherently be any bias a priori in just comparing end line differences if you randomized. Maybe we'll take one more question and then I'll go to the next part on counterfactuals and mode integration. But thanks so much for your question.
We have a question from Barbara in the chat. The question is, in situations where it's not possible to get self-reported respondents, how would you minimize proxy bias?
Yeah. So one of the things that comes out of the study that I just showed you is that by asking proxies to report at the individual level rather than aggregating up for the whole household would be one way to minimize some of those biases, right? So we can't minimize bias from asymmetric information. If people in the household don't know what other people in the household are doing, then you're always going to have that bias from self-reporting. But what you can minimize when you choose a proxy respondent is the aggregation bias that they may face. And in survey designs, one of the things we find, which is kind of tricky in some ways, is that sometimes our intuition about the best way to design surveys actually isn't correct. So what a reasonably thinking, intuitive, empirical researcher might think is like, hey, I want to ask the respondent one question instead of potentially 5 questions, because this will be easier for the respondent to respond to one question instead of 5 questions. But when we ask the respondent one question to report for the whole household instead of to report for each of the 5 farmers within the household, right? we're actually asking them a more cognitively challenging question. And we found that this kind of aggregation bias actually leads to misreporting in data, right? And actually, if I show you, some of these time costs, for example, is not actually that much of a cost saver if we compare in the right table that I have on my screen here, in the green versus the blue in the second panel on the right. There's not that big of a time difference. It's like 4 minutes basically per module, which isn't necessarily trivial, but the amount of bias that we're seeing from aggregation bias from the previous slide is pretty high. So spending 4 more minutes with a respondent seems to be a good trade-off in kind of reducing aggregation bias. So that's one concrete way that this methodological study has given us a clear way forward in making a survey design choice that we would otherwise, our intuition might not have otherwise gone for. Thanks so much for your questions. In the interest of time, I'm gonna keep moving forward to give you a couple more examples. But these are really great questions, and I'm really glad that you're asking them. So I'm gonna go as clearly and quickly through the next section so that we have more time for questions at the end too, and we can keep talking about some of these other design challenges and ways to build better research. Right. So I'm gonna show you or talk you through a few papers that we've written from the same context in Nigeria, where we were working at an agricultural sugarcane plantation. And just to give you kind of the motivation for why we're interested in this research question, and then how we thought about creating a counterfactual and how we thought about doing some mode integration in this study, so you have a little bit of context. But this set of studies focused on the relationship between malaria and labor productivity in agriculture. And so, as you probably know, agricultural productivity is really important in low-income countries, particularly in Africa with smallholder farmers, because we've seen it as a key to growth and economic development, welfare improvements. But agricultural investments tend not to be focused on worker health, right? The ministries of agricultures in our countries and the ministries of health often don't coordinate very closely together to think about worker health in agriculture. From the broader development literature, we know health is a critical component of human capital, but oftentimes the economic gains from health investment are difficult to measure. And so what we're going to focus on is one dimension of a worker's health, which is their malaria status, and try to measure what the effect of malaria is on agricultural worker productivity, right? And so when we think about this question, there's lots of kind of descriptive evidence on comparing workers with malaria and without malaria. There's not a lot of causal evidence on the relationship between malaria and particularly the effect on worker productivity in particular. And that's primarily because there's lots of empirical challenges in kind of linking health and labor relationships together. We have issues of omitted or unobserved variables. So there could be endowment effects, for example, workers' initial health affects their physical work capacity and also affects their likelihood of infection. If you're healthier, then you're less likely to be infected because your body can fight off that infection more easily. We also have issues about reverse causality and simultaneity. So are healthier workers more productive, or more productive workers healthier, or both, right? We also have challenges around measurement again. So measurement of productivity. So we need to measure at the individual worker level, and we need it to be uniform across workers. So we need to consider kind of a homogeneous activity, right? So agricultural workers working in different types of crops or doing different types of tasks, we can't really compare their productivity with each other, right? So just doing a simple household sample probably wouldn't work very well. And then we also have the issue of kind of measuring health or measuring illness. So we use self-reported measures of illness. A lot of workers, especially in endemic areas, in Nigeria, where we did some pilot activities and some focus groups, would call any type of headache that they had malaria, right? And so actually in local language in Nigeria, the word for malaria was actually fever, and not malaria. And obviously fever is symptomatic to several different types of illnesses, right? So identifying malaria specifically can be problematic if we use self-reported information. We also know from self-reported health data that many times people who live in endemic areas don't know that they're sick. So for example, if you wanted to collect information on diarrhea incidents, for example, many people who live in endemic areas where water sanitation is very poor actually don't know that they have diarrhea because it's normal. It's their normal, it's what they're used to. And so reporting it can be problematic, right? So when we're thinking about trying to identify the relationship between malaria and productivity, we have these kinds of challenges to face in kind of creating a study design. And so here's kind of how we designed the study to address kind of some of these challenges. And one of the ways that we addressed these challenges was I got in a car and drove all across Nigeria to try to find a sugarcane plantation. Well, not specifically a sugarcane plantation, but an agricultural site where there would be enough rural workers that we could conduct this study within the particular site. So there would be a homogeneity of tasks that the workers were doing so that we could compare across workers. And it just so happened that there was a very large sugarcane plantation in rural Nigeria that we were able to identify. They had about 800 sugarcane cutters that worked throughout the season. They were organized into work groups and managed by a supervisor, and they were paid on a piece rate basis based on how much output, how much sugarcane they cut per day, right? So in terms of addressing the comparability of the productivity measures by having a piece rate wage system on the plantation and a very large number of workers that were doing the same tasks, we could compare productivity across this subsample of workers or just subsample of workers, right? We're able to link administrative data from the plantation for each worker on the daily amount that workers cut, the days they worked, and their earnings. Workers were paid on a monthly basis, so we thought this administrative data was very likely to be accurate because workers cared very much about being paid for their work, and so would keep track of their own earnings on a daily basis to verify their payments. So a lot of workers had their own kind of ledgers or diaries where they would record to make sure that the plantation wasn't taking some of their wages, right? One kind of interesting feature of this work site, which is going to become very important when we think about mechanisms, is that the way that the tasks that workers conducted were relatively similar across all workers. Workers could, at the beginning of the day, select into cane cutting, which was just cutting the sugar cane that was paid on the fixed rate basis. It was very lucrative to be a cane cutter, and so most workers wanted to be cane cutters because they could earn the most by cutting cane. But on some days, workers could select into doing what was a task called scrabbling, which was a local word basically that was talked about the tasks of some workers going behind the cane cutters every day and bundling the cane cutting and lowering it, loading it on the trucks. And so these scrabblers would get a fixed wage. It was less arduous than doing the cane cutting itself. So it was something that was potentially lower effort and lower return. And certainly when we looked at kind of mean earnings of people, the cane cutters made vastly more money than the scrabblers did, but workers occasionally selected into being scrabblers. Yeah. And so here's an example of a health team visit, like with a worker. We created a mobile health team that would randomly survey workers. And here's some examples of like the cane cutters in the field. It's a little bit hard to see, but in the back past the umbrella, you see different workers in the field cutting cane, and you see workers at different points in the field, right? So some workers are a little bit quicker than other workers in kind of cutting their cane in the field. And so the challenge in kind of this worker population was that the plantation told us right from the beginning that there was no way we could do kind of a traditional randomized control trial where we could have one set of workers receive, say, malaria testing and treatment, and another set of workers that didn't, right? The workers just would be very unhappy with some workers getting some sort of health benefit that might affect their productivity and other workers not. And so we also were concerned about the ethics of this, of like potentially withholding malaria treatment from a subsection of the worker population as well. But we also wanted to think about how to address some of these causal issues or some of these selection issues. So what we did was we thought about how to implement these health clinics. So you see this kind of mobile health clinic that we set up at the side of the field. Obviously, with 800 workers, you can't do a health clinic for all 800 workers in the same week or the same period of time. And so what we ended up thinking about was conducting kind of a phased-in or randomizing the weeks to which workers would have access to this testing and treatment facility for malaria. And using the fact that we couldn't treat all workers at the same time as the basis for randomizing workers to different weeks where testing would be provided to them. And so by the end of the study period, after 6 weeks, we were able to test and treat all workers if they were malaria positive. So we achieved the goal of testing and treating all workers, but we were also able to establish a counterfactual by exploiting the time variation of when workers were tested and treated and comparing workers that had been tested in previous weeks to workers who had not yet been tested over the same periods of time, and then comparing their productivity. So for example, if I look at, I want to create a 2-week reference period, so I can look at workers who were treated in week 2, for example, and compare them to workers who are not yet treated in treatment in week 5, and compare their work over work weeks 3 and 4, for example, to get kind of a 2-week reference period, right? And then I can aggregate across all the weeks to get more power. I can compare, if I want to do a 2-week comparison, I can aggregate workers who are treated in week 1 with workers who are treated in week 4, 2 to 5, 3 to 6, and so on and so forth, to create a larger sample to estimate my treatment effects, right? So that's kind of one creative way we address kind of the ethical and the contextual challenges of creating a counterfactual by using a time-varying randomization. There are lots of advantages of using kind of this approach in kind of estimating this effect of malaria treatment on workers. So let me show you a few results, and then a surprise we got in the results, which led us to think about doing some mode integration. So here's some results. They're pretty interesting. We show like ITT results on both the 2-week reference period and the 3-week reference period to show some robustness. We think that workers, for example, who've been treated for malaria might take a little bit of time to recover, right? So what's a good time period to allow workers to recover to see kind of the full treatment effects? You might think that the 3-week period might be better. Some people might think the 2-week period is better. So we're kind of agnostic and show you both. And what we find is kind of interesting. We see that there's an earnings effect by having access to this testing and treatment program, about 14% over a 3-week period. The labor supply effects are pretty similar. You treat workers for malaria, they work more. And so some of this earnings effect is due to labor supply effect of workers working more. But some of the earnings effect is also due to this productivity gain we see, particularly in the 3-week period, um, um, on workers increasing their productivity, right? So cutting more cane per day, right? If we look at the treatment on the treated, we see that there's a similar earnings effect for those that are treated who are malaria positive and that were treated for malaria. We see that most of the earnings effect here is among workers on labor supply, right? So sick workers went back to work, and this was the primary gain in their earnings was through this labor supply effect, not necessarily productivity, although their productivity does increase a little bit too. So if you think mechanically how the ITT is estimated, given these TOT results, we kind of naturally thought, well, what's going on with the malaria negative workers too, right? When we look at the malaria negative workers, we see this big effect on earnings as well from workers that were told basically that they didn't have malaria um, in this endemic setting. And their productivity really increases by being told that they don't have malaria, right? Um, and so we were thinking a little bit about like what explains this effect. Is this health information really powerful? There's certainly a plausibly a value to health information, especially in endemic areas. Maybe workers that thought they were sick were kind of conserving effort. And so maybe they increased effort in response to this health information, which allowed them to gain earnings. But how to show this, right? This would be a key kind of mechanism that you would want to be able to show rather than assert from this data. Right? So how did we show this mechanism? One way is just with the data that we have on scrabbling, right? So I told you about scrabbling. And so we saw that workers that were malaria negative, they actually reduced the amount of scrabbling that they did, the lower effort, lower pay job. So workers, when they had information that they were not malaria positive, that they were healthy, actually worked more in cane cutting, potentially a higher effort job than the scrabbling. So this explains part of the increase in productivity. But we also wanted kind of a more concrete way to think about whether workers' physical activity was actually increasing or not. And so we fitted workers in a subsequent season with physical activity monitors. A type of tracker that they could wear on their waist to kind of track their physical activity. And so when we look at the physical activity work effects on workers, we can track, for example, their sedentary hours, their light work hours, and their very active work hours. And we can also look at the distribution of their activity. And we found ITT effects increasing among workers who worked on a given day, that they reduced their sedentary hours and increased their most active hours in response to having access to the health information from the program. If we look at the distribution of hours too, we see that the ratio of hours in higher activity work hours goes up substantially, right? So by building in this mode integration, we were able to kind of look at our initial household and administrative data and interpret clearly a causal mechanism for why a somewhat surprising result of malaria negative workers having a productivity effect, and explain that more clearly by having the objective data of the physical activity monitors. So this is an example of mode integration. It's potentially a very powerful policy solution. In malaria, we've been talking about for a long time just getting access to treatment for people that need it in rural areas, and potentially to promote the development of a malaria vaccine. But what this research shows is that testing is really important at a population level, and testing is pretty accessible and relatively inexpensive. And if it has these types of productivity gains for the economy, right, the health system should focus not only on treating people who are sick, but also providing health information to people who live in endemic areas. And that's a very powerful policy result that came about from the integration of kind of mode integration of these physical activity monitors. So just to kind of sum up, how do we build better research? Well, I've given you a couple examples. They're not the only answers for sure, but the things that I'm most excited about are thinking about building methodological experiments into our pilots, by thinking creatively about counterfactuals to answer interesting questions, and then also to think about where mode integration and technology can help us complement face-to-face household surveys that are so valuable, but oftentimes are limited in some of the types of information that we want to collect. So things like passive sensors, audio recordings, remote sensing, crowdsourced data, telephone surveys, incredibly exciting parts of work and very high returns, I think, in terms of building better data and better research, right? So I'll stop there. If there's some questions, I'll turn it over to Raquel to moderate. But thanks so much for listening. I'm interested to hear your questions either now or feel free to email me after the presentation. If you have other things that you'd like to talk about, I'd be happy to talk to you.
Thank you, Andrew, for the great presentation. We still have a question in the chat from the first paper you discussed. From Hector, it said, did you collect information on agricultural or household income in this methodology experiment, one of the most noisy variables in primary surveys? Could you please share your thoughts or insights on how to collect data on that variable in order to minimize measurement error?
Yeah, so agricultural income is quite challenging for several different reasons. One is that farmers harvest at one period of time and usually sell their harvest at different periods of time. So certainly when we think about like single cropping agricultural seasons and cereal harvests that are kind of like the main harvest periods, many times farmers will harvest, they'll stock a big portion of their harvest and sell a portion of their harvest, but then also continue to sell from their stock at various other times in the year. And many development interventions actually try to encourage farmers to sell at other times in the year because prices tend to be higher in the farther away you get from the harvest period. So this is kind of an inherent limitation of household surveys that are collected at only one time in the post-harvest period. So one way to think about improving measures of agricultural income is to think about integrating telephone surveys in the way that we collect data from farmers to capture better when farmers are actually selling their harvest, because that's a big part of agricultural income data collection. So that's one approach.
Thank you. Also, please feel free to raise a hand and ask the question out loud if you'd like to. We have another question here from Cyrus. Great presentation. For those working in social sciences, there are ethical concerns that are raised on the use of RCTs, especially in the education settings. One of the concerns raised mostly is why are you denying a child access to a treatment? Although, as a practitioner, I really like RCTs, especially on addressing selection bias, which I think you also touched on in the most recent paper you spoke about.
Yeah, I think ethical concerns are certainly important when we think about RCTs. There's a couple of like broad categories of ways I think about ethics in doing social science research with RCTs. So the first is I think you need to think about whether the juice is worth the squeeze. And so what I mean by that is, are you asking a question that's going to generate significant enough information or potentially new information that it's worth doing a randomized control trial to answer that question. Are there things about the way that you're doing the randomized control trial that address certain sources of bias that you can't know otherwise? So in the malaria example, right, there are certain sources of bias that we could never control for or account for in our design if we just compared malaria people who had malaria to people who are negative for malaria. And that's true in the educational setting as well. There are some things that we might think work in education, but we're not sure about. And we're oftentimes surprised by the research that we do, right? Both in positive ways and also in ways that we might not have thought there would be a big impact of. And so I think this issue of like, are we really withholding treatment from the control group? I think the first way that I would think about that as an ethical researcher is to think about, is the juice worth the squeeze? Am I really going to learn something very important from this study by creating exogenous variation in a population? The second thing I would think about when you think about being an ethical researcher and using randomized control trials is if you learn something interesting, how do you scale it up? And there's a principle when we do IRB reviews of the principle of benevolence, right? Or benefice. Sorry, benefice is the word I wanted to say, benefice. And so the idea of benefice in ethical reviews is that the people who participate in the study should benefit from the study, right? And that means that if important information is generated, it should be shared with the control group at some point. Right. And so do you have plans as a researcher? Do your partners have a real interest in, making and creating policy impact from the work you're doing and using the results to benefit the control group in the future? And in a lot of cases in educational settings, the answer for that is yes. Things that are learned to be best practices in education do get diffused, and we have lots of examples of that. And there's lots of welfare that's been created and learning that's been created in the educational system because educational researchers and economists have done randomized control trials together. There's always ethical issues in thinking about using randomized control trials. But the reality is that we don't have enough resources to do everything all at once. And it's not clear, even if we did, that would be the best strategy, right? So testing things out, learning from it, and scaling it up, I think is a much more efficient way of generating new knowledge. And a lot of the things that we think are effective are not actually effective, and lots of things that we're not sure are effective, we actually find are. And so it's really important to learn. The importance of learning can't be understated.
Thank you. I think we've got time for one last question. So
Sure.
Carmela asks, the methodological experiments within the research are new and interesting. I'm curious if adding this step affected the timeline or cost of the research. A practical concern is convincing project managers, donors, etc., to get their buy-in.
Yeah. So this is definitely something to think about. Again, is this a methodological challenge that's important enough to invest some pilot resources into? So the first thing I would say is a lot of times we budget pilot resources and we don't know how to really use them, right? Sometimes we budget in for a pilot and we just go to a few villages and test out our questionnaire, but we kind of know already, we kind of do like bench testing in the village setting, and we can do this much more efficiently and use our pilot resources much more efficiently by integrating small methodological experiments into our piloting budgets. Doing something more rigorous in our pilots would really benefit our studies a lot. I would also say that for a lot of these methodological studies, they don't have to be as powered as our main studies do, right? So for these methodological biases, we should be seeing big effects if they're worth us addressing in our study design, right? And some of these effects that I showed you on proxy response bias and asymmetric information bias are big. We don't need huge sample sizes to be able to address these types of questions. And so I think that the fact that methodological experiments should be low cost can be an easier way to get buy-in. The last thing I would say too is that a lot of these questions are thorny questions that practitioners and implementers really care about, right? And your enumerators, when you do enumerator training, will ask you tons of questions about. And whenever your enumerators are asking you tons of questions about how to administer your survey in the field, here you have a methodological question that you should be addressing, right? And so, this is a really concrete way to answer those questions, to give good guidance to the people that are collecting your data, to give good guidance on and stimulate the questions of the practitioners that are also facing these measurement challenges, right? So discuss, learn from the people you're working with, and invest in using pilot resources to answer these questions, as opposed to just generating some consensus within your group, right? Sometimes our intuition is not correct.
Thank you. Do you think we can answer one more question, or should we end? I don't know if you've got a hard stop now.
Yeah, I'm happy to answer one more question. Maybe just a plug too, is so we have this research and methods initiative at the Global Poverty Research Lab, and oftentimes we generate resources or have small calls for integrating methodological experiments in your research designs. So be on the lookout for that. If you're interested, there are donors that are interested in kind of topping up with small amounts of money to do this type of work. And we also have a publication outlet for methodological work. So sometimes it's a little bit difficult to publish one-off methodological studies or field practice studies. And at the Global Poverty Research Lab, we have a working paper section called Research Methods Notes. And if you're interested in writing up in a very short form, or a shorter form than you would for a journal article, some of the things you've done when you've piloted or done focus groups or qualitative interviews, we're providing a publication outlet for those types of insights. So do get in touch with me if you're interested, if you've done some of this work and want to find a way to create a public good with it. This is one outlet that we can use to amplify that type of work.
Thank you. So the last question that's in the chat is, in the case of malaria and workers' productivity, since the intervention is kind of staggered, how do we ensure balance?
Very good. So yeah, there's lots of ways we think about balance when we use a phase-in randomization. So check out the appendix of our paper, for example, for a wide array of different types of balancing tests that we've conducted. But yeah, I think one of the interesting things about constructing a counterfactual is then to think about how do you validate the observable characteristics with balancing tests. And so what we can do is we can do balancing tests across the different weeks that workers have been assigned to see if the worker characteristics are similar across the weeks that workers have been assigned to. So normally when we think about balance tests, we compare between treatment and control. And here we have different assignments of workers to work weeks, and we can check for balance across those work weeks to kind of validate the random assignment.
Thank you so much, Andrew. I think everyone learned a lot from this presentation and found it very interesting. So thank you for taking the time to present today.
Yeah, thanks everyone for coming. Yeah, appreciate it. Don't hesitate to reach out.